Hi, my name is Rebecca Hall. I've chosen to present case 4 for my ELP assessment task 3. Hope you enjoy. Here are the learning objectives for my presentation. So the first learning objective will be identifying and explaining the key ethical and professional issues raised by the case that I'm about to talk about. Secondly, we will identify and evaluate different options and describe strategies that I recommend for addressing and managing these issues. So at the end of this recording, you will hopefully be able to walk away with some of these strategies that you could implement into your practice. Moving on to the case that I have chosen, we have Miss L. So basically, you are a busy family practitioner working in an independent practice. You see Miss L, a 45-year-old corporate lawyer who has 2 children, who comes in complaining of fatigue that's been going on for quite some time, several months duration. She reports working very long hours, preparing for a case, and has been feeling stressed on top of this as her assistant has gone on maternity leave. She discloses that she hasn't been eating as well as normal or getting enough sleep. You and Miss L both agree that she should try to maintain more balance in her life. But just in case you want to rule out if there's any other causes of fatigue going on in the background, you decide to send her to get some basic blood tests. You tell her that the office will call her only if the results are abnormal. Otherwise, Miss L should come back to see you in 3 months' time for a review. When Miss L returns for her follow-up as scheduled, you look at her chart just before she comes into the room. To your own horror and disbelief, you realise that the blood work indicated a significant reduction in her platelet, red and white blood cell counts, which is consistent with aplastic anemia. You can't remember or recollect ever having looked at this report. It's come as a big surprise to you. Miss L comes in and she says, "Doctor, I'm feeling really exhausted, even though I'm getting enough sleep and the court case has been settled. What do you do next?" So looking at this case, I found that the first key ethical issue raised was definitely duty of care. So duty of care refers to the obligations and responsibilities placed on medical officers to provide a minimum standard of care to their patients and the community. The minimum standard of care is based on the expected standard of an ordinarily competent practitioner carrying out the same task or role. This is further imposed on medical officers by the law, which ensures that diligence be adhered to in situations where it can be reasonably foreseeable that harm to patients may arise due to actions or admissions placed by the doctor. This is further highlighted in the Medical Board of Australia's The Code of Conduct for Doctors in Australia. Duty of care exists as soon as the practitioner assumes responsibility for the care of their patient. In Miss L's case, it is evident that the family practitioner had assumed a duty of care to Miss L. The second ethical principle that I thought was quite evident in this case was the ethical principle of non-maleficence. This concerns an intention to avoid unnecessary harm or injury that may arise through acts of commission or omission. It involves imposing a careless or unreasonable risk of harm upon another person. Our role as medical officers is to ensure our primary concern with our patients is to do no harm or ensure the least amount of harm possible in order to reach an outcome that is beneficial to the patient. With Miss L's case, this wasn't adhered to in the most appropriate manner. Miss L went through months of ongoing symptoms to her presenting complaint that could have been prevented if this ethical principle had been adhered to. One of the key professional issues that I found in Miss L's case was the issue of miscommunication. Failure to communicate diagnostic test results to patients is one of the leading causes of medical misdiagnosis and has a potential to lead to dire consequences. Patients have a right to be informed of their results in a timely and appropriate manner. By not adhering to this, the potential for harm to the patient is greatly increased. Harm also encompasses not just a direct injury from the failure to communicate the results, but also includes the progression of an injury or illness. In Miss L's case, this is evident in her subsequent visit to the doctor, where she discloses a continuation of symptoms despite trialling other measures as had been previously suggested to her. Communication issues in healthcare has been implicated in studies as a leading cause of medical malpractice cases. Alarming findings include 36% of abnormal results were acknowledged by physicians, and that 17 to 32% of physicians reported no reliable method for ensuring that test results were received. Concerningly, one study found that 1/3 of physicians did not notify patients of their abnormal test results. Communication of test results is a complex issue which is frequently discussed within literature. The leading causes of communication issues include an inability to notify the patient of their test result, providing incorrect test results to patients, and an inability to notify the referring clinician of their patient's results. Regarding why these issues arise, studies have found a general consensus within the medical fraternity. Frequent reasons include an inadequate and ineffective tracking system for test results, poor documentation, failure by office staff to adhere to the scope of practice requirements, and growth in the volume of diagnostic tests. Another study attributed the increasing volume of diagnostic tests and the limited resources available to manage this as another confounding factor to this issue. The same study also found that current systems did not provide a routine method for tracking patients' results and instead relied on patients' inquiries to raise awareness. Reliance on patients to phone or attend follow-up appointments for test results is problematic. It has the ability to cause issues, particularly in the case that results become misplaced or the patient fails to make contact with the practice. It is the responsibility of the doctor to determine why a patient has not returned and identify suitable further management. A review of incidents of potential or actual harm to patients found that a lacking protocols for ensuring action on results of tests and investigations meant that the important results were filed unseen or left until the referring doctor was next available. An immediate effective strategy to address the issue of non-communication regarding Miss L's results is through open disclosure. The use of open disclosure provides a consistent and reliable foundation for communication following unforeseen healthcare outcomes and harm. It is a right of all patients cemented in professional ethics, considered to provide good clinical practice, and constitutes the care continuum. It has been shown to provide benefits to both clinicians and patients involved in adverse events. Whilst complex and at times challenging for participants, it does provide a systematic approach to assist in the management of adverse events with compassion and empathy, and also provides broader benefits through improved clinical communications and systems improvement. In Miss L's case, an open disclosure can be achieved by ensuring to notify her of the mistake, express regret, and provide an explanation of what has happened to rectify the error if possible, and discern the potential outcomes for Miss L and implement change to prevent recurrence. A long-term effective strategy that can be implemented to assist in ensuring adequate and timely results are provided to patients is the use of a recall system. A recall system is set out in the RACGP's Standards for General Practices, who recommend practices utilise a system to review, act upon, and incorporate into patients' medical records all results and clinical correspondence received. The aim of this is to ensure that clinical care of patients is reviewed by a medical practitioner and acted upon accordingly. The standards also specify the need for a system to provide follow-up and recall of patients with abnormal results. While practices are not expected nor obliged to make contact with patients with the results of all investigations, the risk to patients in not following up abnormal results may be significant. Abnormal results must be reviewed by a doctor to determine its significance to the ongoing care of the patient. This strategy also adheres to Section 2.2 of the Good Patient Care of the Medical Board of Australia's A Code of Conduct for Doctors in Australia. Underpinning this section involves the maintenance of clean and accurate medical records. Thank you for your time in listening to my presentation. Hopefully you've been able to walk away with those answers to their learning objectives and you're able to utilise this information in your practice. And here is a list of all my references that I have used throughout this presentation.